Well, hello and welcome. You're watching India Fights Back with your host, Rajat Kain. In this episode, we'll discuss the surveillance, containment, and management of COVID 19 by health authorities across the country, along with the pace of vaccination. In the past few days, let us put it, in month of July, we have seen spike in COVID numbers. Well, this spike happens to be under control right now, but what all we need to do so as to keep it further under control, and which are the problem areas that needs to be addressed and worked out. To discuss further on this issue, we joined with a panel of two guests, Dr. Arun Sharma. He's Director, ICMR from Jodhpur. Many thanks, Dr. Sharma, for joining us. And Dr. D.K. Gupta, he is from the Felix Hospital. Many thanks, Dr. Gupta, for joining us. Let me start with you, Dr. Sharma. So, if we summarize, we're in the first week of August now. How has been the month of July for COVID-19 in terms of how far have we been able to control it?
Right. So if we look at the data, the number of new cases that are reported every day, we saw a very positive trend there. There was a continuous decline, and the number of cases fell down drastically, and we came to the level of 30,000 at one stage. So that was a very promising thing. And in some of the states, the number of cases came down to two digits. And in some districts also reported no cases for a consecutive period, and the number of deaths have also considerably declined. So that was a very promising phase in the first 3 weeks of July. But after that, a little bit of concern has started appearing because we are seeing now a reversal of the trend and the number of cases are increasing. But that could be within the limit of permissible variability that
Okay.
is linked to the number of tests being performed. And the reporting cycle is not constant across a week. For example, on Saturdays and Sundays, we see less number of tests being performed. So the number of cases come down. So a weekly moving average, a 7-day moving average is a better trend. And that may not be available right now for the last week of July. So we are still a little alert and cautious whether the number of cases are actually rising or it's the correction mechanism which is taking place.
Right, that's important. Whether number are rising at all or it happens to be the correction. Yeah, please, sir, please go on.
Yeah, so that is what we need to look at. And at the same time, we also need to look at the number of active cases because if the transmission is increasing or new cases are likely to come up, that will be a function of the active number of cases. So we are seeing that the active number of cases had also been declining in the first 3 weeks of July. So we are very hopeful that the things at present are under control. Of course, the newspaper reports coming from the last 2 days showing a rising trend, particularly the increase in the number of cases in Kerala. And I heard that Kerala is contemplating a lockdown again. That means there is a warning sign, and we have to be cautious in what happens in next 7 days. That will be the deciding factor, whether we are at the verge of starting of the third wave or we are still in control of the situation. Over
Right,
to you,
right.
Rajat.
Yeah. Many thanks, Dr. Sharma, for your opening remarks. It's fairly elaborates, of course. As Dr. Sharma mentioned, the numbers that we are seeing, they were controllable till a point, and after that, we are rather seeing a spike, not very alarming, but spike nonetheless. Dr. D.K. Gupta, Chairman, Felix Hospital, many thanks, sir, for waiting in the wings for us. Sir, we often, whenever we discuss of the numbers or other increase or change or whatever we call it, we also juxtapose that with the vaccination. Now, if we look back at the vaccination drive, what are the key areas that still needs to be addressed?
Okay, I think Rajat, this is a great question. And we know that there are only two ways to control COVID in our country or anywhere in the globe. That is implementation of the COVID approved behavior, and second is vaccination. And the most important out of these two is vaccination. And currently, it's a good sign that we have inoculated around more than 47 crore of our population in India. But still, we need to inoculate at least put similar numbers more within couple of 3 or 4 months only. Otherwise, it will be difficult to control third wave. It will be difficult to control even fourth or fifth wave also. And like Uttar Pradesh, and there are few states that are doing good in the vaccination program, but still, I think there is a shortage of supply, maybe because of less production of the vaccine in India, and because of we have a large number of population. We have around 140 CR our population. There is a high density of population in India, and for providing vaccination for this number of people, it's very difficult for any country. And as Government of India is planning to give around 116 CR of vaccination till December this year only. So most probably next 3 months will be very crucial regarding the vaccination, and we will inoculate significant number of population till December, and that will be one of the most important step. But because we are on the verge of third wave currently, and also not third wave, we are not able to control second wave in around 10 states of India, right? Kerala, Maharashtra, Tamil Nadu, Odisha, and Andhra Pradesh and Northeast state. Still, there are around more than 40 plus districts in these states where positivity rate is high. It's around 10%, and these are the most important districts where state government needs to prevent or curtail movement of people, or they need to avoid gatherings, and they need to avoid rallies or dharna protestation. Everything should be controlled in these districts to spread to prevent the spread of infection in the community. Otherwise, it will be very difficult, because the government of these states needs to be very forceful in implementing COVID appropriate behavior in these districts. I will also tell you that about 80% of these patients' active cases are in home isolation, and most of the patients now they are complacent. They are not following home isolation guidelines, and they can be super spreader for the infection to their neighborhood houses, villages, mohallas, or communities. And therefore, the government should have a keen, strict watch on these home isolation patients also, for regarding their movement, they are following criteria for home isolation or not. Also, they should follow their monitor. They should follow and monitor their vitals also, their health conditions also, because these patients can collapse or succumb anytime. They can increase the fatality rate also. It means these patients should be followed in two ways. First, they should not infection. They should follow all home isolation guidelines, regular check, regular calls, regular follow-up from the local administration should be there, health authorities should be there. Second, also they should be followed for their vitals. They should follow for any danger sign like chest pain, breathing difficulty, loss of consciousness, bleach discoloration, cyanosis, or any serious symptoms, so that immediately they can be taken to the hospital for effective and early management, so that death can be prevented. Third, I will tell you, there are few states where that positivity rate is less than 10%. Even they are now complacent. They are opening up like everything is now unlocked in these states. So these states should also be very careful regarding the COVID appropriate behavior. And second most important thing is also focus on their vaccination drive. Like they should involve private sectors, but to have some private partnership to increase vaccination and inoculation percent. Like we need to control, if we need to control this COVID, then definitely there is only one weapon against it, that is the vaccination. If we vaccinate around 70 to 80% of in population of any state, that will have herd immunity. But I think that is most important. And in last
Right. Dr. Gupta, just stay on. Many thanks for your opening remarks. Dr. Sharma, you also agree that COVID-appropriate behavior and vaccination are extremely important, or to say quintessential measures so as to contain the spread of COVID. And also, I want to pick your thought. How has been our vaccination pace, especially in states where we have more mobility of people, that's the intrastate mobility, and also say clusters or areas of higher density?
Yes, Rajat, I absolutely agree with Dr. Gupta that vaccination and COVID appropriate behavior, these are the two key weapons we have. Now, they are effective only when there is an absolute participation and cooperation from the people in general. Now, it is equally important that we need to open up our economies for economic reasons and for the mental health
Absolutely.
of the people. I understand that. But at the same time, there is a need for a strict enforcement of COVID appropriate behavior. I would like to illustrate that. For example, okay, the markets need to be opened, that's absolutely fine. But keeping that restriction of allowing only restricted people to enter into a departmental store at a given point of time, not allowing a crowding to occur, ensuring that the shopkeepers as well as the people who are going into these malls and departmental stores maintain that wearing of the mask in an appropriate manner, and maintaining the sanitation and hand hygiene, and at the same time the distances are very important.
Right.
Unless we do that, we run the risk of spreading the disease again, having the number of cases rising again, irrespective of the vaccination. Why? That also needs to be emphasized for the viewers that look, the vaccine is primarily aimed at reducing the severity of the disease
Mm-hmm.
and reducing the fatality. The number of people who will be dying will be less. But the vaccines that we have at this moment is not good enough to control the transmission of infection.
Mm-hmm.
That means even a vaccinated person is likely to harbor the virus in his respiratory system. And when he thinks that he's vaccinated, so he is now absolutely protected, that misconception should go. He still has to wear the mask so that even if the virus is there in his respiratory system, he prevents spreading it to the other people. And
Right.
secondly, since the number of people vaccinated are still not to that adequate level, that everybody is vaccinated to that level, we still have only 26 crores fully vaccinated.
Mm-hmm.
47 crores have got only first dose. So keeping that in mind, a substantial proportion of the population is still more susceptible and vulnerable to the disease. So it's not only my protection alone by the vaccine, it's a question of protecting my neighbors, the people who are coming in contact with me. So in order to make sure that this does not spread, we have to keep the vaccination drive in a full scale possible, as well as very strict enforcement of COVID appropriate behavior, at least in all public places. And a third dimension, Rajat, I want to add here that home isolation is absolutely fine,
Mm-hmm.
but we need to be very careful about the quality of ventilation that we maintain in our
Okay.
houses. Having closed rooms with air conditioners on and not purifying the air or not allowing a cross or natural ventilation increases the risk of the virus remaining suspended in that air for a longer duration, and thereby in making other people more likely to get infection. So
Hmm.
my appeal to the viewers will be that please, now the weather is better. Now it is not as hot as it was in April, May, or June. There's rains everywhere. So now try to be more, have a natural ventilation. Let's have more cross ventilation
Right.
rather than confining it to the closed rooms. And still, if there is a patient who is in home isolation, we have to be equally strict about maintaining COVID appropriate behavior within the home also, like putting on the mask because there is a patient inside the
Mm-hmm.
home, maintaining social distance and the hygiene. We have to be very emphatic about it. Otherwise, we will be again on the losing side of the battle. And maybe the third wave will become a very significant one, just like the second wave.
Hmm. Well, that's important. And clearly, as Sir, you mentioned, appeal or to say suggestion to the viewers when it comes to home isolation, it's good to have, it's strictly suggestible to have cross ventilation in the room. Dear viewers, listen to experts. That's what I keep emphasizing in this show every time. You know, I mean, do not listen to any hearsay or any misinformation. There are a lot of avenues that we come across every day, passing on information from here and there, unconfirmed, unverified reports about COVID 19, about uh, possible remedies for COVID 19. Do not fall prey to it. Listen to experts. They we have in this show Dr. Arun Sharma, Director ICMR, and Dr. D.K. Gupta, Chairman Felix Hospital. They are the experts. They are talking about COVID 19, vaccination, and what we need to do. Dr. Gupta, we just heard Dr. Sharma talking about, say, home isolation, vaccination, and of course, like COVID appropriate behavior. So, my question to you is, since you also discussed about vaccination, uh, the cases we are seeing in some states which are on the rise, what perhaps could be reason for that? Is it like, some slip by the residents themselves, they're not following COVID appropriate behavior, or the density itself is so, the population density happens to be so huge that sometimes even vaccination is possibly not as effective as it could be.
Yes, and as
Dr.
Dr. Arun Sharma told that vaccine is not preventing infection, spread of the infection. It is only preventing serious complication, disease, and death. It is not preventing the spread of infection. It means vaccination is important to prevent the disease and prevent the death and complication, not to curtail the spread. Therefore, the only one weapon there is, that is following your COVID behavior, because we know our population density is very high. Therefore, it is very difficult to obey, follow the COVID behavior. But if there is no choice, I think. If we will not follow, then we will face the full lockdown that we have already done in last 1.5 year, 2 times or 3 times. We have faced long lockdown. So if we want to not face this type of full lockdown where everything is curtailed and there will be stoppage of the movement, you will be restricted to your home, then we should follow the COVID appropriate behavior. Even in COVID appropriate behavior, only masking is not important. I think double masking is important. Regular changing of the mask is very important. How, if you are using fabric mask or surgical mask, how you are sterilizing these masks. Even surgical mask should not be reused after 8 hours of medical mask. Even fabric mask should be sterilized in a hot water for 30 minutes with soap and water. Treatment should be there, and they should be reused. One thing more, only masking is not important. If we follow the COVID behavior, it means we have to do hand washing and social distancing with masking. Then they are very effective. Single masking or single hand washing or single social distancing is not effective. As WHO is also telling us again and again, if we follow all these 3 parameters, then there will be effective containment of infection. Otherwise, we will not be able to contain the infection. Second thing, I think government is also should have some stricter or like forceful guidelines to implement COVID behavior. I think we all, whenever we see there is a sudden surge of infection, sudden rise of cases, then everybody wakes up. Even government there started imposing fine and etc. for these those who are not following COVID behavior. Now it is the right time. I think this is the phase for next 2 weeks are very important for all of us. There will be surge, there will be third wave, we know. But next 2 or 3 weeks are very important if we want to curtail or we want to have a dent on this third wave, if we want to flatten the curve of third wave. Definitely COVID appropriate behavior is the only choice left to everybody, and every citizen of India should be responsible for the following up this COVID appropriate at the ground level, and state government, because the health is a matter of state government. They should be accountable. Central government should make them accountable if there is something wrong. Like we have seen in last month that there were tourist high flow to the like tourist places in the Himachal Pradesh, Uttarakhand, and the government was they were doing, but they were not effective. Enforcement was not there. I think there should be accountability and responsibility of government and senior citizens of India. Then we can definitely contain, curtail, even dampen the curve of this third wave. Otherwise, it will be very difficult.
Right. That's important, Dr. Gupta. Many thanks, for explaining us what all needs to be done. Dr. Sharma, sir, as just go towards the close of the show, very quick remark from you, sir. Among the groups, even among those who are vaccinated, which, as per their age or their medical condition, would you suggest they need to be extra cautious or they need to take a lot of precautions?
Yeah, so we have the vulnerable population groups. If you recall from the beginning of the infection, we talk about people having comorbidities, people are senior citizens, and there are people whose immunity is otherwise compromised, either because of the disease or the treatment. Some people may be taking steroids for some other diseases, for chronic conditions, and their immunity is suppressed. People having diabetes, their immunity is poor. And there are other population groups also, because of other background reasons, their immunity is poor. So in spite of taking vaccine, their response in terms of the antibody levels into the blood may not be adequate. So those are more important groups, and they should consult their treating physicians, treating doctors about the risk of having COVID infection because of this underlying vulnerability.
Right.
And of course, our senior citizens protection is very important from that point of view, so that not only that they suffer, they also become the super spreaders of the condition, because the people who are, they are more informed, they require care to be given in a more specific manner by their family members. And I've observed in my experience with some of the families that when a senior citizen has fallen sick and is COVID positive, then the family members who are trying to help out, because they require physical help in their movement, in their food and all that, they have to go very close. And when they stop following or they are failed to follow the COVID appropriate behavior, other family members rapidly get infected. So we have to be very careful about with these vulnerable groups of people and while providing care to them.
Dr. Gupta, sir, your closing remarks on the same question. We saw during the second wave or in the month of April and May, a lot of youngsters, they were the ones who were actually hit by COVID-19. How vulnerable does youngsters still remain today? I mean, even the ones who have taken vaccine.
Yeah, I am a pediatrician. I will tell you that still there is a significant population of youngsters. They are not have received the vaccine and they have not been exposed to the natural vaccine also, and they are at high risk and they are vulnerable. Or this is the virgin population who can get infected, and especially children or who are having teenagers, especially teenagers who are having obesity or any asthma, congenital heart disease, cardiac disease, renal disease, kidney disease, dialysis or thalassemia, cancer. These high risk population at high risk, and they should be definitely protected from exposure to the virus, and that is the most important. Second, lesser age group, definitely we know that death rate is quite low, but still we do not know what the new variant will come, what Delta plus, what will it will do. This was the variant who has given the Trahimam or tsunami in the April and May, and it can definitely affect more children. And we have seen some syndromes, some serious illnesses in children also. That multi-system inflammatory syndrome that occurred in significant population in India also, and the children were quite serious. Even they were have to be in ICU for longer stay. In India, we don't have very good intensive care units, intensive care setup for children also. Therefore, this is a high time we should protect our children by following COVID behavior by ourselves and training them. Otherwise, it is not possible. And there is a good news also that we are going to have vaccine for teenagers maybe in September, of month of September. Jadis Cadila will be having approval for the teenager population, and maybe in November we will have younger vaccine for younger population also.
Right, right. Absolutely. So there we have hope and, of course, promise with ourselves that we'll follow COVID appropriate behavior and also get vaccinations, especially those groups which are eligible. So clearly, there we have this discussion in the show, once again highlighting what all we need to do for maintaining COVID appropriate behavior and containing the COVID numbers from rising again. Many thanks, Dr. Arun Sharma and Dr. D.K. Gupta for joining us and elucidating on this extremely important aspect. Well, that's it in this edition of India Fights Back. Thank you. Goodbye.